Good afternoon. My name is Mark. I've been asked to do a shoulder examination on you. Can I please check your name
Andrew,
and your age?
26.
Okay. Are you in any pain?
No.
Okay. I'm going to do a shoulder examination on you, and what this involves is me making some observations about it, and I'm going to ask you to do some movements as well. Is that okay?
That's fine.
Okay. Right. I'm observing the patient's shoulder. I don't see any scarring on the joints. Shoulders look asymmetrical. There is no asymmetry of the joint. No fasciculation, and there doesn't seem to be any muscle wastage. Alright, could you please turn around for me, please? Alright, I'm going to raise your shirt, check your back. And there is no weeing of the scapula. Alright, and the shoulder girdle looks symmetrical. Okay, I'm going to ask you to perform some movements for me. If you could just follow after me, please. Raise your hand like so. Okay, and if you could move them all the way back. Yeah, thank you. And to your side. Okay, and this way across your body. Alright. And if you could do this. Okay, and inwards. Alright. So, flexion and extension look good. The abduction and adduction look good as well. Internal and external rotation look good as well. Alright, Andrew, I'm going to do those 6 movements with you this time, alright? Okay, so I'm just going to put my hand here. If you could just raise your hand all the way up, please. Thank you. And back. Okay. Up to the side, please. Alright. And across your body. That's good. Okay. You just stand that way. Alright. Okay. The other side, please. Okay. All the way up. Yes. Back. Alright. This side. Okay. Alright. Oh. Yeah. Okay. Alright, that's great. I'm just going to ask you to raise both your hands behind your head, please. Okay. And the same position behind your back, please. Alright, great. Thank you. Okay, Andrew, those functional tests look alright. I'm going to now ask you to do some movements which are the special test. Now, I'm going to show you how to do these movements, and what I want you to do is resist against me. Okay? This is just to check if there's any weakness in the muscle. Alright? Okay, the first one, I want you to extend your hands like so, please. Okay, this is the Job's test. And resist against it. Okay, very good. If you could rotate your thumb downwards. Okay, very good. This test is for the supraspinatus. Alright, now I would like you to do the Hawkins test. Please, could you put your arm like so? Okay, and just resist. Alright, the other side. Okay, resist. Alright, great. That's for the teres minor, infraspinatus, and supraspinatus. If you could turn around, please, and do this. Sorry, do that. Yeah? One arm at a time, yeah. Okay. And if you could just resist against my push, please. Okay. And the other one? Just resist again, please. Okay. Thank you. And that's what the subscapularis. Okay, Andrew, I'd like you to do this now. Okay. This is the scarf test. Alright, and the other side. Okay, very good. That's to check for indicative osteoarthritis of the AC joint. Right, now I'm going to do the anterior shoulder drawer test. Okay. Alright, let's just check for this. Alright, okay. The other side. Okay, and that's to check for any laxity of the anterior capsular mechanism. Alright, now ideally I'd also like to do a shoulder apprehension test, but that should be best done when the patient is supine and I don't have an examination table at hand. That test would be to test for any lateral lesions or bony lesions at the anterior inferior rim of the glenoid. Okay, and that concludes the shoulder examination. This is a normal clinical examination with no abnormal pathology. Now, ideally, to complete the examination, I would also like to check the joints above and below. That would be the cervical spine and the elbow. And I would also like to order a plain film X-ray of the shoulder joint.
and a full blood test as well to check for any inflammatory markers.